I'm going to be demonstrating a running stitch. Now the running stitch differs from individual stitches in that the running stitch is one continuous stitch that runs from one end of the incision all the way to the other end of the incision. Remember, for individual stitches we start with one stitch in the center, we do the rule of halves to break it up. This doesn't happen with the running stitch. The running stitch is typically started from one end, goes to the other end. If you're right-handed, it's usually better to start from the right side and work to the left, or from the top and work downward if the incision is vertical. If you're left-handed, it's typically easier to start from the left side and work to the right side. Now the start of this is done two different ways. You want to basically start like you're doing a simple interrupted, and I'm going to go in the skin about 1/8 inch back from the edge, pop through. Okay, notice I'm turning the skin upward, so there's no chance of my needle poking into the patient. I come through, and at this point I can close this up by doing a simple interrupted stitch, or a more efficient way of doing it is to basically tie a knot on this end of the line and use this as my anchor point. So I'm going to demonstrate that method. Okay, so I basically pick the line up a little bit, the suture material, I wrap it around my needle holder 3 times, I reach down and I just grab the thread below and I pull my knot off, forming a loop on the skin surface. Okay, I do another wrap, my second knot, I grab the loop fairly high up and I pull my second knot off, placing it right over the first knot. So we've got 2 knots on top of each other. I do the same thing with my third wrap, pull it off, make sure all 3 knots are lined up on top of each other. So this is going to be my tie-off point. So I pull it down flush to the skin. I typically now go back at this time, before I do any more, and cut off the excess just so it doesn't get in the way and interfere with stuff. Okay, now I'm ready to go ahead and start my stitch. This is a running stitch, and this is very simple, simply kind of a hemming stitch that most people that do a lot of sewing are very familiar with. I'm basically going to go across at an angle, about 30 to 45 degree angle. And I'm going to reach ahead about 1/4 inch, about 1/8 inch back from the edge, just like my simple interrupted distance. Turn the skin up, go through. I want to come up directly opposite on the other side, about 1/8 inch back from the edge. Pull through, and you can see that I'm starting with a nice diagonal there. This stitch is nothing more than a series of these, continuous series of these, with an advancement each time of about 1/4 inch or 3/16 of an inch, somewhere in that range, making sure that wherever you go in on the upper side, I'm a little close, I'm going to back up just a little deeper, okay, that wherever I go in on this side, I come up directly opposite or slightly backwards, slightly back towards the previous stitch. This allows me to maintain my positioning. Separation between them, you can see, is about 3/16 to 1/4 inch between them. I'm going to reach back a little again, come across. This skin is very soft on this pig, so this isn't quite working out as nice as I would like to see it, but this is, you kind of get the picture of what it's looking like as I come across. Okay, again I'm going to advance again, pop through, turn the skin up. I always turn the skin up. I always basically come in so I'm coming directly across or slightly behind, and this is going to allow me to get this nice diagonal position that I'm looking for. We're looking for uniformity, because remember, this is all that the patient sees of the surgical procedure. So if it looks like you've done sloppy suturing, they're going to assume that the surgery itself was also sloppy. Okay, you can see I'm getting close to the end. Pop through, come up on the other side. Okay. So at this point, you can see the skin is very flat. I want to slightly evert this, so I'm going to put tension on this end. I'm just going to kind of reach through and kind of snug up the whole area a little bit, keeping tension on here so that the loops don't tend to slide as much. And this is going to allow me to kind of snug it a little bit tighter like that. Okay, to close this off, you can see they're at an angle. Nice, fast, easy way of doing it. I'm going to maintain tension on this, do my 3 wraps, 1 wrap, 2 wraps, 3 wraps. I'm going to let go hold the line with my 3 fingers, second, third, and fourth finger. I'm going to leave my thumb and first finger free to grab the line, maintaining tension all the way. I'm going to grab it right at the skin base. I'm going to pull off my thread, and I also start having a single loop there. I'm going to do a couple more wraps on that. Okay. Like such. And this is my simple running. I then want to work back, go back through the skin a little bit, kind of lift it up a little bit. I want to squeeze it if I need to. I want slight eversion on the skin surface all the way across. And this is your simple running stitch. So it's diagonal, 1/8 of an inch back from the edge, about 3/16 to 1/4 of an inch distance between them, and you just run from one end to the other. It's a very fast, easy stitch, and it's very, very commonly used by many doctors.